And together, we will move mountains. And if they don't hear our message, then we'll just do it over and over and over and over 1,000 times again for you. And I'll rise up, I'll rise like the day, I'll rise up in spite of you.
Hi, everyone. My name is Michelle Zabel, and I'm an Assistant Dean at the University of Maryland School of Social Work and Director at the Institute for Innovation and Implementation. As you all know, this year of working virtually has necessitated some really creative approaches to conferences. We've spread the training institutes out over the last 9 months, just a few workshops each month. And I just want to personally thank you for joining in these discussions. These workshops have been so much richer because of you sharing your experiences and ideas to meet the needs of children, youth, young adults, and their families. So today, I have the exciting opportunity to remind you of some general housekeeping items. Even in a virtual world, they don't let me out of this part. Our workshops are being recorded, and your participation does imply consent. Also, please remember, if at any time you need help in navigating through the virtual spaces or accessing the links to workshops, we have a live help desk chat that is being monitored during the duration of the entire workshop. Our team is posting the link to connect with the live help desk in the chat box now. During all the workshops being offered throughout this series, I really want to encourage you to actively participate by using the chat to post your questions, any comments, and any resources you want to share with your colleagues. Our presenters absolutely want to hear from you, and we know your participation makes the workshops even better. We have staff monitoring the chat in Zoom and on YouTube, and they'll be assisting with facilitating the questions to the presenters and making sure that the presenters' resources are shared with you. So finally, there'll be an ASL interpreter available throughout the workshops. Interpreters will be shown on your screen, and they can be pinned for those who require interpretation. So you want to hover over the video and select the 3 dots. One of the options that appears is pin video. So by selecting that pin video, this video will now not move out of view. This summer, we are continuing the training institutes in a way that will allow you to take us wherever you go. So hopefully you're getting to take a break, a vacation, and get some relaxation. We're recording our summer workshops and releasing them each month so you can watch them anytime during the month that actually works for you. These workshops are on a wide range of topics, all focused on strengthening your skills as you support youth and families. While you're enjoying these summer workshops, we're going to be planning and working towards future training institutes, and hopefully we can all see each other in person. Thank you so much. Take care and enjoy your summer.
Good afternoon, everyone. My name is Andrew Hunt, and I will be one of your presenters today. I'm joined by my good friend and colleague, Raquel Aviles from the Pascua Yaqui tribe. I'm going to be starting off today, so just a brief introduction of myself. I am an enrolled member of the Lumbee Indian Tribe of North Carolina. And I am a commissioned officer in the U.S. Public Health Service. I have served for the last 30 years with the Indian Health Service and SAMHSA, and then back again most recently to close out my career with the Indian Health Service. And I am here to help provide some historical context around the Circles of Care grant program. Just a little bit about myself and the Circles of Care program. I have been in one way or another part of the Circles of Care grant program since it first began. And I'll be going over some of that history a little bit later. But I started off, my first exposure to the Circles of Care grant program was when it started back in 1998. And I was the mental health director at the Puyallup Tribal Health Authority. And we were invited to go to a bidders meeting at SAMHSA, learn about this new grant program that they were developing. So I learned a lot about it, got very excited. Unfortunately, when I went back to the tribe, they were not interested at the time in applying, so we didn't apply. It turns out that several years later, after I left, they did apply. But so that was my first exposure, and then I joined the National Indian Child Welfare Association in the year 2000 to be part of the technical assistance that was provided for Circles of Care in the very first cycle. So I spent the first, spent 6 years from 2000 to 2006 as a technical assistance provider, working with Circles of Care grantees. One of them was the Pascua Yaqui tribe, among many others. So getting to work directly with the tribes and urban Indian programs that were doing Circles of Care across the country, visiting them and learning from them, and being involved as their trainer and technical assistance provider. Then in 2006, I took over the role of the project officer at SAMHSA from Jill Erickson, who was my predecessor. And I was the lead for SAMHSA with the Circles of Care from 2000 until 2006 until 2019, when I came to Indian Health Service, my current position as acting deputy director. So that's my brief bio of myself for Circles of Care. I will let Raquel introduce herself when her portion comes. So I'll jump right into the presentation and kind of giving some background about Circles of Care. So let's see. There we go. Okay, so sorry about that technical difficulty. So these are us. Now, our objectives for today. The first thing is we're going to talk about the system of care principles and how they can be used to develop culturally based services for American Indian Alaska Natives, youth. We're going to discuss the Circles of Care approach, how that can shape the community change. And then we're going to describe examples. Specifically, Raquel's going to go in depth with Pascua Yaqui. If we have questions, we can also talk about some of the other sites that we're familiar with and things that they have learned. So my role here is to provide that national and historic perspective on the Circles of Care grant program. Now, sometimes my wife teases me about when I tell a story, I go back to the very beginning of time to start my story and don't just get right to the point. So I hope that you will excuse me from not getting straight to the point and providing a little bit of context to our discussion. I'm not going to go back quite to the beginning of time, but I will go back to the beginning of the system of care and Circles of Care process. So if we go all the way back to 1984, the National Institute of Mental Health had a program that they called the Child Adolescent Service System Program, or CASP. Now, this was a program that was designed because at the time in the 80s, people came to a realization that the mental health system, specifically for children, was not working. The children were getting lost. They weren't getting the help they were needing. The system was not set up to help them. So CASP was initiated, and funds were given to states to plan and evaluate strategies for how to improve children's mental health systems within their states. And then as a result of this, SAMHSA in 1992 created the System of Care, that'll be abbreviated as SOC, but the System of Care grant program. That began in 92 with these grants, large grants to implement what states had been spending years developing through the CASP system. So in the legislation that authorized the System of Care grant program, it was states, counties, cities, tribes, and territories were eligible. So governmental entities were eligible, tribes were eligible. However, because tribes were not included in the CASP planning efforts for the previous 8 years, tribes really weren't ready to accept these grants and to do the work. So between 1994 and 1997, there were only 3 tribes that received system of care funding. As a result of that, some of the tribal advocates around the country began to express concern that basically they felt the states had an unfair advantage over tribes being able to access these funds to improve their children's mental health, and that Indian children were, equally, if not more so, in need of system improvement. So a lot of leaders in the tribal communities, advocates within the government got together over a period of about 3 years in the mid-90s to talk about what could be developed and how a program could be put together. So between SAMHSA, the Indian Health Service, BIA, and the Department of Justice, they developed this concept, this idea that they were going to call Circles of Care. And it was going to be launched as a pilot project funded through SAMHSA. Now, back then, all of these agencies actually kicked in some funds to get the program started. So it was a joint effort originally, and it was going to be managed by SAMHSA. So in 1998, the funds started. This was the first SAMHSA grant program that was specifically designed for American Indian Alaskan Native communities. So they did not have to compete with states for this program. This was the first time that SAMHSA had ever done that. And the other thing that made Circles of Care unique was that there was a specific emphasis on community-based and cultural approaches. And this was because the tribal communities and tribal leaders were basically driving this, that it was very much a culturally driven grant program, and that there was an important emphasis on providing tribally specific technical assistance. So up until this point, just for more context, the System of Care grant program had technical assistance to help states and tribes implement, but those technical assistance providers were basically focused on state level. They knew states very well, but they did not know tribal communities. So there was an emphasis here with Circles of Care that this really needed to be tribal focused. And this was tribes and urban Indian programs. So for those of you from urban communities, I'm sorry, when I say tribes, I colloquially mean tribes and urban altogether, even though I definitely know there's a distinction. We might talk about that later. So just for clarification, when I say tribes, I mean all Native communities. So the goals of the Circles of Care program, when it was announced, and these goals have stayed true through the program, is that we wanted grantees to design their own holistic, community-based, coordinated system of care model, which we later came to call the blueprint. And the other goal was to change the community approach to serving youth with mental health challenges and their families. So moving from a deficit-based approach focused on pathology to one that was more strength-based, moving away from the kind of the Western model of medicine and incorporating more tribal cultural ideas into the way that children would be served. The other goal was to increase the capacity of the programs and the workforce. So we saw that there was a lack of tribal mental health providers and people who were really trained to do that. So part of Circles of Care was to build that workforce. And then finally, to build on the cultural strengths to address the needs of the community. So this was another, again, distinct difference between other grant programs that preceded it. was this is not about bringing in experts from the outside telling tribes what they needed to do, or looking at how bad things were in the community. This is really about getting with communities to help them find their cultural strengths and the strengths that they have to build on from there. Now, once the grants were awarded, SAMHSA, we had some expectations of grantees. And one was that we expected them to emphasize a community-based planning and development process. So Circles of Care was designed as a planning and development grant. It was not about providing direct services. It was about taking time to really plan and be thoughtful about how services should be delivered. So we really emphasized that this is a community-based process. This isn't about hiring the best, smartest people from the country and having them lock themselves in a room and write the blueprint. This is about getting out into the community and hearing from the community members. We also expected grantees to be a catalyst for multi-agency systemic change, realizing that good system of care and approach to children with mental health needs is not just one agency's job. There are multiple agencies that need to be involved in helping us. So having that be an emphasis. To go along with the first, actively engaging a wide range of American Indian community members, not just the staff, in every phase of community-based culturally relevant planning process. So we really want people to get out there and talk to the community members. The other expectation was that they would be developing a policy reform and infrastructure to support the change to a coordinated system of care approach. So this really is about a paradigm change, and it's built on the system of care principles, which we'll talk about a little bit later. And if you've been attending other Training Institute sessions, I'm sure you've heard plenty about the system of care principles, because the Training Institute is really founded on those principles. So in the grant program, that we had some requirements that guided this process. Now, even though there were requirements, there was a tremendous amount of flexibility in exactly how this looked like and how tribes chose to implement these requirements. But we felt like these are requirements, steps in the process to get to the final product, which was really the blueprint. So the first thing was to do a community needs assessment. And that was a community needs assessment focused on children's mental health issues. So to focus specifically on that. And then once the needs assessment was done, or in parallel, they're also doing a readiness assessment. So finding out how ready is the community to actually address the needs of children's mental health. How ready is the community to adopting a system of care approach and making a systems change. The next was to do a community resource or asset map, and otherwise, so look around the community and see what resources are there. And this is not just about the formal services of this program and that program, and this agency and that agency, but also some of the informal or traditional resources, traditional culture resources that were available. All looking at all the supports that are available to children and families across the community. And then social marketing plans. So you're trying to create a social change and a paradigm change, and you really need to have an effort about how to communicate this change to the community to get buy-in, and not just buy-in, but community ownership over the process of change. So social marketing and public education was a key part of that. A process evaluation was a requirement to just basically keep track of what you're doing so that later you can kind of tell your story. So the process evaluation was about telling the story of the process of Circles of Care. We asked them to develop a local evaluation plan. And again, this was completely dependent on what the community themselves wanted to evaluate. It may be something around cultural identity. It may be something around the number of providers, maybe whatever. We allowed them to choose what kind of evaluation they wanted to focus on locally. And then the system of care model, the blueprint, was really the culmination of all of the work. This is, as we talked about the blueprint, I often used to say, we're working on Circles of Care to build your dream house for what you think your community would like to see, the way children are served in your community. So that's really the culmination. After the blueprint is done, where there was an implementation plan. In other words, okay, you've got this blueprint for your dream house. It looks great. Everybody loves it. Now, how are you going to build your house? What's the next step? How are you going to start building? What's your implementation plan? You're going to start small over here. You're going to try to go for the whole thing. Develop an implementation plan based on your blueprint. And then an outcome measurement plan, again, was dependent on the grantee themselves, which basically asked the question, okay, if you build the house, how will you know that it fits your needs? What are the outcomes that you're looking for to tell you that you built the house correctly? So those were some of the requirements that were in the funding opportunities. These varied a little bit over the years with each cohort. Some of the things are added and some were left off, but these are basically the kind of the model process that anybody can do. You don't have to have a Circles of Care grant to do this process. Certainly helps, but this is a process that we'll be talking about that kind of guides that. So SAMHSA's role and my role as the project officer and the program lead was to continue to secure funding for a new grant cycle every 3 years in the federal budget process. Circles of Care is a discretionary grant program. So occasionally over the course of the 20 years, there were times when someone in senior leadership at the agency said, hey, I hear that Circles of Care grant program is ending in next year. What else can we do with that money? Let's close that down and try to do something else. So part of my job was to try to continue to advocate and say, no, this is important. We've only funded this number of tribes. We've got a lot more to go. Let's keep this going. The other thing, SAMHSA's job was to manage contracts that provided that culturally competent training and technical assistance to the grants. So from the beginning, as I mentioned earlier, that culturally competent training and technical assistance for grantees was integrated early on, and that was part of the program. I will say, unfortunately, in recent years, with changes in SAMHSA, again, I'm no longer with SAMHSA, so I will say this, that they stopped some of these contracts. My hope is that they will, under new leadership, that they will revive those contracts so that the current grantees, if any of you are listening, hopefully can benefit from technical assistance in the future. But that's part of SAMHSA's role, is to really provide that support that grantees need. Maybe Raquel can talk a little bit about what technical assistance actually does to help grantees in this process. Circles of Care is not an easy process. You need support, and so that's something that has really helped with the success of the program. The other thing we did at SAMHSA as part of our role was to support the peer-to-peer relationships between grantees in each of the cohorts. So it's, as we'll talk about later, it's funded in cohorts, and then also making sure that current grantees are connected to previous grantees to learn from the lessons learned. So we really look at Circles of Care as a family. Each cohort is a kind of its own group, its own family, and once you become a Circles of Care grantee, you are part of a larger Circles of Care grant program that has been going on since 1998, and 20 years of people trying to do the same thing. So you're part of a family. Which gets us to the next thing. I'm going to kind of go back a little bit about the system of care principles. So we have talked about this, and I'm sure you've talked about this in other seminars, and with this, hopefully some of you out there are already in system of care, Circles of Care communities. So one of the things that one of my previous supervisors, Ms. Mary McNevins at NICWA, when I was there, she knew that I was a musician, and she encouraged me to use my musical talents to help write a jingle or a theme song. I like to call this an anthem. So system of care is a movement, and I think every movement needs its own anthem. So if you'll excuse me, you can click on this link at some point later, maybe when it goes live. I recorded a version with the band in my home studio, but I'm going to do just a little impromptu version here. This really was designed to help people remember the system of care principles in a fun way. So this is the system of care song. Family driven, youth guided, community based and culturally competent, individualized, accessible, strength based and interagency, coordinated and collaborative. Put them together and you got a system of care, a system of care, a system of care, a system of care. I need a system of care. You need a system of care. He needs a system of care. She needs a system of care. They need a system of care. We are a system of care. We are a system of care. We are a system of care. All right, thank you for indulging me in my little solo performance there. So hopefully the goal of that is to help you remember in a fun way the system of care principles. So if you want to hear a full version, you can go to SoundCloud and hear it with drums and bass and organ and piano and background singers and the whole thing. So moving right along. Our system of care grants. So we wanted to talk about who they are and a little bit about where we started. So we've identified all of the circles of care grantees. First cohort. Now, I'm just gonna let you look at these. I'm not gonna read each name. The ones that appear in red are those grantees that went on to get a larger system of care implementation grant through SAMHSA after they finished circles of care, or their circles of care model was used by another organization in partnership to get a system of care grant, or they received another SAMHSA grant to implement their model. But basically the ones in red were able to get additional funds from SAMHSA to implement the model that they developed in circles of care. So if you notice, there's a pretty high percentage of these first two. Again, going back to, I'm going to be an advocate and say technical assistance was very strong during this period. You can see Pascal Yaki is there and circles of care 2. That's Raquel's going to talk more in detail about them. Circles of care 3 and 4, again, pretty strong showings of those tribes that went on to get the system of care grants. And then we're on to circles of care 5 and 6. In circles of care 6, we really only had one of those that went on to get the system of care grants. And then the currently last funded circle of care 7 that ended in 2020, one of those, SAMHSA has continued to award circles of care grants. There's been 22 grants awarded since 2019, which is when I left SAMHSA. So if you'll notice, just to keep in the back of your mind, there were a lot of grantees that got system of care grants after their circles of care early on, not so much since around 2016. Note that date, just keep that in the back of your mind. So originally the only measure of success was, or the intended measure of success was to get a system of care grant to implement the model. So again, 21 of the 30 grants that finished in the first 5 cohorts, and only 3 out of the last 22 from cohorts 6 and 7 went on to receive a SAMHSA grant. Now, that's not to say that that's the only measure of success. Those that did not get a larger grant from SAMHSA, many of those were able to find alternative ways to implement their model, such as redistributing existing funds within the tribe or the organization, contracts with counties or cities or counties, other federal grants. So just because they didn't get a system of care grant doesn't mean that they were not successful. It just means that they weren't successful in getting a larger SAMHSA grant. So we want to keep that in mind, that everybody did accomplish something. So some of the outcomes that we see across all of those sites across 20 years, we did a retrospective study, had a contractor do that. And these were kind of the top 3 findings that we had, was that there was success in obtaining funding to increase service delivery. So regardless of whether they got a large system of care grant or not, it was pretty much across the board. There was an increase in service delivery. Obviously, there were a few communities that weren't able to pick up the ball for a variety of issues. I think probably related to readiness and maybe issues in the community where there was leadership changes where they sort of got the ball rolling, and then there was leadership change and somebody said, no, we're not doing that anymore. So that's always a reality in tribal communities. Anybody who's worked in a tribal community knows that a tribal election can change direction at any time. So some of the challenges in implementing are often not no fault of anybody working hard during this circles of care period. So and then the second thing is better understanding community needs and strengths, and then bringing Western science and American Indian culture into harmony was also something that people felt across the board, kind of bringing those 2 elements together. So some of the other outcomes and impacts that we saw across the communities, and maybe Raquel can talk a little bit about what this looked like in her community. Engaging youth and families in developing future leaders. So there are many people that were involved in circles of care as a youth member of the youth committee, or a family member who was just quote just a mom or just a dad who got involved in an advisory committee and then later went on to do something in their community as a leader. So this was a really big, something that was never really written into the grants. It was a very nice, what I call a byproduct of the process. So that's one of the things I think that is that's often not measured. There's a lot of people out there who kind of got their start in circles of care. The other outcomes: building collaborative relationships, establishing cross-sector government partnerships, reducing the stigma of children's mental health, and there's various other ripple effects and byproducts that lead to positive changes. And that's the last thing I'm going to say. So speaking of positive changes, I'm really happy to turn over the mic to Raquel, who's done some great things in her community and been part of their work. So I will pass it on to Raquel.
Thank you, Andy. It's been a wild ride these 20 years working with Captain Hunt in several capacities, as he mentioned, when he did help us with technical assistance back in Circles of Care days, and being a project officer as we received funding from SAMHSA. So it's been a long journey, and I feel, even though it's been 20 years of Circles of Care, the work continues on. I don't think you ever complete that work with your community when you're trying to serve your community in the best way possible and to bring resources and other entities together. So I am very happy to be sharing the Pascua Yaqui story. As Andy mentioned, my name is Raquel Aviles, and I am a tribal member of the Pascua Yaqui tribe. And back in 2001, when I was doing the Circles of Care project director, I can honestly say I didn't know what I was doing or what was going to happen with this. I just learned about what Circles of Care was about. I just had twins at that time. And honestly, I was like, wow, this seems like a lot of work. I don't know if I could do it. But I had the privilege of hearing the stories from the first cohort, because unfortunately 9/11 happened at that time. So the first cohort presentations were postponed. So once everybody went back to travel, I was able to, to be there and present and hear all the work that the first cohort did. And basically they said the same thing, that they didn't know what they were in for, but the products and the byproducts and everything that happened with Circles of Care really gave me the drive to step out of my comfort zone to do it. So it's been an honor, and it continues to be an honor to talk about Circles of Care and help other tribes as they're on their journey. Next. So just to give you a little snapshot of our tribe, as I mentioned, we were the second cohort, and it was really hard for people, our service providers, the community, and our agencies to be, what do you mean a planning grant? We're hurting now. We need services now. So it really took some education and awareness to our community and our partners at that time to let them know we're just slowing down the train right now, and we're trying to see what is out there. How are our youth and families that are, in the behavioral health system, in the education system, in the court system, are receiving support during this time of need, or they need that extra support. So it took a while before, people were able to grasp the concept of planning grant, assessing grant, going to the community and asking the community, what do you want? What do you see? Are we meeting your needs? So that was the majority of the work, was calling in our community members and really asking them, can you be a part of this coalition? A lot of families were frightened and scared to do that because they didn't want to be identified as, behavioral health, or that their youth or children or families were receiving services. So it was really, an effort to ask them to come to the table and basically tell us your story and your needs. And after they saw that we were listening and that the tribe really wanted to know how things were working out, we had people asking, can I be a part of Circles of Care? So we ended up having two community coalitions, one located in our federally recognized reservation on New Pascua, and one also located in Guadalupe, which is our larger community on the outskirts of Phoenix, which I'll show you a map. And then we did have an advisory board made up of leadership and service providers from education, courts, social services, and behavioral health. Next. So this is just a snapshot of our communities currently. And I always like to show the historical map of where we came from the homelands of Mexico and Rio Yaqui. And back in 2004, seems so long ago, we only had 13 tribal members, and now we just did our count and we're up to 2002. So there's a lot of growth with the tribe. It's a young tribe, and to provide services, just for that one part and one system of the part really takes, a team and a collaborative effort to really support families that are in need. So I always like to show, the tribal members and how much we need, when also our funding isn't increased federally. So there's a lot of, pieces to the puzzle that we have to do to make sure that our tribes and our services are meeting their needs. Next. So this is one of my favorite pictures. It's our community in Guadalupe, Yo en Pueblo. And this is a mural that the youth worked on as part of Circles of Care. And the community came out to dedicate, the mural and for the children to really tell the story of what this meant to them and the picture of wellness. And when I look back on the days of Circles of Care, I really saw that it was that gathering of voices and giving voice to the voiceless, the youth and the parents that were in the system and that were just going through the motions because they've had another youth go through behavioral health, the court system, social services, and they were just doing what they were told to do or what they had to do. And the Circles of Care gave them an opportunity to really talk about that. If their needs were being met, if the services they're receiving really helped and support them. And we also were able to pull in our elders that really gave us, a sense of our culture and where it was going and how the community was going and how our elders really felt about the path that our youth and our parents were leading when they were needing behavioral health services, and really look at the core needs of the community and where are we going as a community. And it also brought service providers to the table where we can really ask them, these questions of why do you think parents or families or youth are not coming for services? And we saw a real disconnect between what the service providers thought versus what the parents were saying why they didn't go to services. A lot of them felt like the families didn't care, that they just didn't want to come. And we were learning that there was some practical barriers like hours of services, lack of transportation, even working at the casino. By the time they got out, they weren't able to go to appointments or go to services or any type of activities because of their work schedule. So it really shed some light on our community on the disconnect between services. And also it gave a picture to tribal leadership of what's going on in our silos within our tribe, and how there was some disconnect between the state and federal agencies and also local, like with local schools. We don't have a tribal school. So we saw that there was a weakness in there. So it really brought everyone to the table to really slow down, and instead of assuming why things weren't working or what was working, it really gave us that opportunity to give a snapshot at that time of our system and how it was happening. And as I mentioned, the internal services, there was a lot of silos, and people were receiving services and the community not knowing of the services. So there was really a time to really just refocus on what was out there and what we need. And again, with outside agencies and other systems, how our partnerships were, how were our relationships, and what needed to be strengthened or what needed to be collaborative. Next. So what happened with our Circles of Care? As Andy mentioned, there were a lot of products that we had to do, and I can honestly say if it wasn't for the technical assistance, we would have really been lost. We had, at times I felt like they were holding my hand through the process, because we were, especially with my background, it was more preventative health. And we were like, what do we do for our needs assessment? How do we describe this systems of care? And we really had good technical assistance that at the time they could come and travel and really learn about our system and what were some of the issues we were having. So it was really beneficial and build capacity. I mean, that sparked my interest to continue with my education. So really build that capacity within the tribe and within tribal members, that they learned this step of how to assess. Now I want to learn more. And it also gave our community a space to define what we were going to, or what we were going through. Like serious emotional disturbance was at the time one of the terms we had to define. And our community is like, we're not going to label, our kids are labeled enough, so we're going to describe what serious emotional needs are, or serious emotional disturbance are, instead of putting another label on our children and families. And then we're able to package this up and create a feasibility assessment of if we do everything, like Andy said, the dream house, this is how much it would cost, this is how much we would need, and this is what we would need to do for the next round, and this is what we wanted to do for our systems of care. And even though that, was enough work, the community and decided to have their own products, as Andy mentioned, the byproducts. A lot of the youth felt like there was no direction, so they wanted to know and have a visual of how do I become balanced. So the coalition decided to do a balance model, and with the stages of change, to really show the youth and families that they are improving and that they are on a path to wellness and healing. So we're able to create that. And then with our pilot project, we're able to do an equine program that has grown tremendously over the last 20 years and is on an 80-acre ranch now. And I think one of the most things that I'm very proud of are our tribal members, and how giving them that voice empowered them to do more, to run for council, to become, a provider, to become a behavioral health technician, to go back to school, and to really be a voice in the community. Next. So these are, I call them the OGs. These are the original graphics that we did to show what we wanted our services to be. Over the years, they have changed and they have been revised, but I always go back to the beginning, because I really feel like this is where the community really said, no, I want the sewa, which if you look in the middle, that's our wellness model. We want the sewa, the flower, to be in the middle, because the sewa is a blessing, it's a miracle. And we want that to be the focus of our families, and that they can have the sewa and be blessed. And all the visuals and the symbolism that went into that, they put their heart into that, and they really asked the elders, to bless these visuals. And so I always go back, when I think of Circles of Care, to the original artwork that was presented. And then on the right side of your screen is the Yaqui symbols for the stages of change. And this was needed as a crosswalk, I call it, to really help our providers that weren't aware of our Yaqui culture and symbolism, to really show and to use this as a tool to explain to their youth and families, this is where you're at in the stages of change, but this is your path. So it really, built that connection where the service providers that weren't aware of Yaqui culture were able to explain the path and the healing of the family. And then on your left is we call it the spiral. And even though this was focused for youth and families that were in the behavioral health services, families really wanted to make sure that there was a path for youth that were at risk or that wanted to learn before they became diagnosable or before they became too bad. I know families always said, my child cannot receive services because they're not too bad yet, or they're not there yet. So they really felt that some of the youth were falling in the cracks. So they wanted to make sure there was a preventative and an intervention path. So these were some of the byproducts that Andy talked about that came out of the Circles of Care project. Next. So we applied for the Circles for the Systems of Care twice. Once was when we had Circles of Care, I think in the first year or second year, and thank God we didn't get that, because we weren't ready. We weren't ready for the Systems of Care yet. And we applied for the Circles of Care the Systems of Care as we're wrapping up, and we didn't receive it. And it was, a bummer, because as Andy mentioned, that was sort of one of the measures of success. You get Circles of Care, you get your data, you get your plan, you get your feasibility plan, and then you apply for the Systems of Care, and then hopefully that gave you sort of, the leg up as getting all your data and information together, and then you could get the Systems of Care. So we didn't receive it. So luckily within the health department, we're able to use all that information and data and feedback from the community to restructure circles of care, because the community didn't want circles of care to go away. They loved the interactions, they loved the engagement, they loved that they were part of the change in the community. So that they wanted to keep the circles of care name, and we just transformed it into youth services. So we just put all our youth services that were in several programs under circles of care. And that was a fun time too, because we were able to collaborate and leverage our resources and work together with all our programs. And then we were able to establish the equine therapy program that, you know, started with a couple of families and a couple of horses that we had to break down the panels every time we went. It was like on the road type of show, till now where it's at a ranch, and there's like a waiting list sometimes for equine therapy. And it's not just with our youth, it's with families. And then also they want to start a program, if they haven't already, with our veterans. So it's really taken off, and the community really loves our equine therapy program. And then we've gained a lot of support from the communities and tribal leadership. I almost felt like it was an open door. Oh, it's for circles of care, it's for the kids, go do it. And we really had that support where we're able to grow our program, grow the staff, and also apply for grants, because they knew it was based on the community's feedback and the community's needs. And then, as I mentioned, many of our, I believe it's 5 if I look back, our community coalition members were elected into tribal council over the years. And sometimes more than others, we have past OG Circles of Care coalition members. And as soon as they know that, you know, Circles of Care is a part of this, which is now called Sewa Usim, they really try to support that endeavor, because they know it's for the youth and families. Next. And I just wanted to give a snapshot so everyone can see, you know, from the foundation of Circles of Care, and how that really opened the doors for the tribe to really, you know, focus on our system of care for our youth, and how we were able to use the data and the feedback and the community assessments and all that information that we were doing during Circles of Care, to use it to apply for other grants. And we even shared it, you know, with our other departments, so they could use our information for grants. And that was just like the launching point. I remember back then, that was, Circles of Care was like the largest grant that the health department received. And as you've seen, it's just grown over the years, hiring the right people, hiring the right leadership to take Circles of Care and Sewa Usim to another level, and just continue to grow, and putting the pieces of the puzzle together to strengthen our systems of care for our youth. And then not only, you know, getting grants, but also producing revenue out of the services that we're able to provide. Next. And I always like to highlight on Tortuga Ranch, this, back in the day, there was just like a little ramada there, and all this was just desert. It was just dirt and desert. And with the revenue and help with tribal council and the health department, they were able to build this infrastructure and have this meeting and gathering place for our community. And if you can see the tile work on the pillars, those are the symbols for the To Good order chart. So there's a lot of, you know, stories and impact that the work from Circles of Care has done, and continues to grow. And it's just in different ways and than how it used to be, but it continues to be a part of the Paskoyaki story. And then on the right is the Kave Hitavi, the horse healers, and that's the equine therapy program that is housed at the ranch, and it continues to grow. We used to have many goats and sheep, and we even have an emu. I heard there's some rabbits now there. So the healing animal program starts, you know, grows, and the community continues to enjoy that. Next. So I always say this to people, that the story must continue but not have an end. We received many grants and funding, but as Andy mentioned too, there's a lot of byproduct that has happened over the years because of the foundations of Circles of Care and the leadership and the empowerment that had blossomed from the Circles of Care. There's a lot, we weren't able to do the original Systems of Care, the dream house, but we've been slowly adding a room here and there and building our house to work in a way that they were able to fund it and provide services. So it continues on. I don't feel that there's ever going to be an end to Circles of Care, and as long as I'm invited to help other Circles of Care grantees, which I do with Tribal Tech, and they're an awesome resource because a lot of their technical assistance has come from a Circles of Care project and continues to grow. Circles of Care hopefully will not have an end, because it's just a blessing and a starting point for tribes to actually engage the community and build their Circles of Care. And then I wanted to share too next. I'm no longer with the health department with Circles of Care, but the Bosco Yaqui Health Service Division is about to open a building, and based on the Circles of Care model and the Systems of Care model, they're bringing in social services, behavioral health, sewa usim, and healthcare services to be all at one, because they know the benefits of having all these services collaborate and work together for our families. And so our families don't feel like they have to go all over the place or trekking to different departments and areas to get services. But if all the services are in one area, they will get more care and more services. So I just encourage you all to continue to tell your story, and to also give an opportunity to the community to have a voice. I think that was the number one takeaway, was giving the voice to the community. And sometimes you don't want to hear everything that you're going to hear, but you hear the truth. And I think sometimes you need to hear that. We had to hear, we don't like going to the behavioral health modular because it says behavioral health modular. Maybe you should name it something. So they named it, Centered Spirit. So little things like that we're able to do over the years, when the community lets us know that, maybe if you did this, other people would go, and really listening and knowing they can go to you and tell you what they're thinking is one of the best outcomes of this. And I always remember, and I always tell our staff when I'm training, it's not about us. We can't go and develop programs and say, here's the program, come to it, without the community's voice. We really need to hear what their needs are and what they feel like they need, and listen to them. So together you can build and develop that program or that service or that Systems of Care. Next. And then I just like to share this at the end, what the original coalition's vision was. And I really love it, that where they say, the circles of care must have a beginning, but not an end. And I mean, this seems so simple and easy, but if you have a Circles of Care project or a Systems of Care project, I think that is the remaining, the ongoing engagement, the turnover of staff, the change in leadership, where you continually have to tell your story. You have to tell the Circles of Care story, your Systems of Care story, continually to let the leadership know, these are the needs of the community, and give the platform to the community members so they could tell their stories and hear how decisions on that higher level affect them, how they affect the service providers, and just to continue on and focusing on our youth and our families, and always have our elders involved in the planning and hear their voices, because they ground us as we try to build our community and our services. Next, I think that was my last slide. Yes. So thank you for letting me share, Andy, and inviting me.
Yeah, thank you, Rachel. So Raquel, I'm sorry. And so I think I had actually some questions for you, some things that I wanted to, that I know about that I think you maybe kind of touched on that I wanted to ask a little bit. First, I just wanted to say a couple things. So, one of the things that, as alluded here, that with the idea that there's a beginning but not an end, one of the things that was brought up, several times throughout the course of Circles of Care was, the fact that if you're in a tribal community, everybody knows the story of a tribe that gets a grant for 3 years or 5 years, and they do some really good stuff, and then the grant's over, and they roll up the carpet, and that's it. And then people just talk about it like, oh, you remember back when we had that grant and we did this or that? Yeah, good times. That was kind of fun. Boy, I wish that could happen. It's like, what happened to that program? So everybody, if you've been in a tribal community, you have a knowledge of the old, whatever happened to that program. And it was probably funded by a grant that just, people looked at it like it's a few years to hire some people and do something, and we're going to send reports to the funding agency, and then we're going to move on to the next one, kind of grant hopping. And that's one of the things that with Circles of Care was clear that from the beginning, again, going back to the folks, the tribal leaders who helped create it, that was never the intent. It was Circles of Care was meant to be the beginning. It was meant to be a springboard where it was not, hey, remember that way back when. When you talk about, Raquel, when you talk about remembering Circles of Care, you're not talking about it fondly as if something that was, happened and went away. You're talking about it in terms of the foundation that everything was built on that. And that, I think, is something that's not just true for Circles of Care or the System of Care grants, but as somebody who works for a funding agency or has for the last 30 years, that's really the intent of a grant. So if you are out there and you're working for you're paid through a grant program right now, whatever it is, Circles of Care or Garrett Lee Smith or whatever, some ACF grant, whatever, somebody grant, don't let this just be a short ride where you worked your grant and then, okay, that's done, move on to the next thing. If you believe in what you're doing, then you're going to want to keep that going. You're going to want to have that grant lead to something else and build a foundation. So that's really, that idea is really baked into Circles of Care and also the System of Care implementation. And I think, the Pasco Yaqui is just one really great example, which is why I asked Raquel to be a part of this, because it's a good example of how Circles of Care was not just a 3 years one and done grant program, but really a foundation. So I did have a question for you, and I think some of the success that we look at, there's whole other topic about sort of what were the commonalities of success, and one of the things, if we look at the grantees that were able to really implement, was stable leadership and support of not just the stable leadership in terms of like a project director. For example, Raquel was the project director for the entire grant cycle, and then a few times after that. So having that was one thing, to have a project director who was able to see it through for at least the 3 years, and then hopefully even longer than that. But then also having stable and supportive leadership at the tribal administration level and the tribal elected official level. And one of the things I think that I remember from the site visit at Pasco Yaqui, I don't remember exactly when it happened, but there was I forget what it was called, a memorandum or some sort of edict that came from, I can't remember if it was tribal council or management, that basically said, all you departments who don't talk to each other, you got to talk to each other, you got to work together. Can you talk a little bit about that? kind of supportive leadership and how it, that we talk about collaborative, coordinated collaborative is one of the system of care values. Can you talk about how that leadership helped make that happen?
Yes, that was well, first we asked for an executive order, which basically helped us establish the Children and Family Provider Networking Board. And this board was where at the director level come together and talk about policies, because we were getting a lot of overcrossing policies, and one policy would say kick all the family out if there was something going on in the house, while another policy is like, no, we need to work with that family. So we wanted to build this board. And when we presented to our AG's office, they were like, this should be not just an executive order, but a resolution. So it was brought up to a higher level where now, as you mentioned, it's now a resolution where the directors and their appointees will meet to discuss the children and family services and how we can work together and collaboratively and not, against each other or in silos. So that was something that is there and that is used and it's still continuing. We just had a meeting, a month ago. So it's still being used, and that's still the platform for the departments to come and discuss future fundings, plans, and even work together just collaboratively when they're planning events.
Yeah, thank you. I think one of the other points I'd like to make in terms of the process of planning and developing that blueprint, when we talk about the community involvement, one of the things that I often talked about was again, it's not you hire the best people and they lock themselves in a room and write the program and then come out like Moses from the mountain saying, here's the program. It's not that approach. It's using, I'm a clinical social worker. I had lots of training to do that. Sure, somebody could pay me to sit in my office and write a program and give it to them, but it's not theirs. That's not the community's. So using, my experience or, the director experience in writing, but not in creating. So the creation process is that collaborative relationship with the community. So it's a back and forth conversation. So with like the needs assessment or any of those tools that we talked about, gathering data, it's sending your staff out to the community, asking the questions, whether it's through interviews or surveys or whatever. You take that, you get the information, you get, okay, here's the questions we have, here's what you told us. Then the staff go back and go to their office and write stuff down and say, put it together. And then they go back and they don't stop there. And they say, okay, this is what we wrote, we summarized. Then they go back to the community and have another meeting or interviews and say, did we get it right? This is what we thought you said. Can you tell us, did we get it right? And then there's going to be some things that, no, you didn't get this right. We changed our mind about this, or you misheard us, or so then you go back and the staff go back and they rewrite. And this back and forth conversation over the course of 3 years that's the circles of care process. It's not, you go out, you do need assessment in the first 6 months, say, okay, thanks community, talk to you later. And then you go in and pay your professionals to write stuff up and you come up with a fancy thing. And that's not a whole lot better than sitting in your office by yourself. It's 3 years of back and forth, get in the community. And when we say community, again, family members of kids who are in the system. Who else knows what works and what doesn't work better than the people who are actually either in the system or the people who couldn't get in the system because the rules didn't allow them. Because like Raquel said, you got kids who the family says, my kid really needs help, but they don't have a diagnosis. They're not bad enough to get help. So we need to, that's the way the system is currently set up outside of system of care. The kid has to get to a certain level of acuity before the services kick in. And it really shouldn't be that way. So that's part of what, finding those families that can't get into the system. So the ones who are in the system, ones who can't get into the system, the ones who have been through the system successfully or not, talking with them, and really they're your key informants. They're the ones who really are telling you what's going on, even if you don't like what they have to say, right? They're probably going to tell you things you don't want to say. So I don't know if you have anything to add to that, Raquel.
Yes, Circles of Care is definitely not a check the box deliverable where I did that, check, it's done. I've done this, check, especially if you want it to be implanted in the community. It's really important that the community is a part of the process. They get trained, to do the assessments. They get trained on HIPAA. They get trained how to be a speaker. They're the ones that are telling the story of Circles of Care. I really saw myself as the facilitator where I'm walking in two worlds. I'm walking in the data world, and this is the assessment and using, the deliverables and domains and, assess a feasibility plan. But then I translate it to the community. We're building a house. What's your dream house? If money was no object, how would services look like? What would you do? And for a while there, you get a blank stare because the community is not used to that. The community is not used to the services coming to them saying, what do you see, or what do you want, or what do you think? So it's really taking the community with you on this journey of Circles of Care, because it's not a straight line. I mean, I've had meetings and 10 things I want to go over, in my meeting because I need to get this deliverable done. And it gets off course in a good way because a youth decided to stand up and say, I am ADD. I am ADD. I just, and starts telling us their story. And then the elder stands up and says, no, you are not, and speaks words of empowerment to them. So it's not an ordinary grant where it's just a job and I check off the box and here's the deliverable, SAMHSA. It's really implanting that concept of the principles of care and how that translates into your culture and into your community, and highlighting that and just weaving it through the services you have and trying to change the dynamics and the thinking of how you provide services for your youth and family. But I know you can't write that in an RFP for SAMHSA.
Yeah, so I think we have some questions in the chat, which I cannot see. So if there's someone from the university staff that could jump in and help identify those questions. I did just see one question says, does this work with children with special health care needs outside of mental health? I would say yes. I mean, this grant just has to be focused on children's mental health, but the approach that Circles of Care promotes and that System of Care promotes, I think could be applied to children with healthcare needs, could be applied to adults. It just depends on what you want to focus on. This, again, the funding for this was from SAMHSA Child, Adolescent, Family branch. So it was focused on children. Again, going back to the very beginning of the mid 80s, this was created because children were left out of the mental health system. So that's the focus. But I think this could be used with any population, the process itself. So I don't know what you think, Raquel.
No, and it's great that you mentioned that, because before COVID happened, the tribe wanted to do a circles of care with our elder population. So we were revving up to start doing an assessment and getting a group of elders together and training the staff on the whole principles of care and how that would translate to our senior center and our elder population when COVID hit and, you know, everything was shut down. So I know now that the vaccinations are going out and you know, things might be getting back to normal, you know, soon, they're going to ask for that circles of care for our elders. So the whole learning that whole process and building that capacity within your tribe or organization is something that you can take it to, I would say, any type of, you know, system that you're focusing on. So I'm really excited about getting started with doing that just for our elders.
Great. So we have one more question. I'm the System of Care Coordinator for our region, meaning I help stand up and support sustainability of governance meetings that support System of Care collaboration. I work with our state's Medicaid Coordinated Care Organization. We are always talking about how to collaborate with tribal entities, but haven't had success in building connections to collaborate. How should we go about building trust with tribal entities in our regions to support collaboration in a culturally responsive way?
Sorry, that's a great question. That's a whole nother workshop in itself, actually. States working with tribes, state tribal relations. I'll just say it. I'm not sure what state you're in, but one of the things you have to take into account is the historic relationship that your state has with the tribes within your borders, which may have absolutely nothing to do with mental health. There are some states that just tribes have a very bad taste in their mouth. Nothing related to the good work that you're trying to do. It may be related to gaming, or maybe related to land use or fishing rights, or, you know, government to government stuff. Not mental health. So I think that's the first thing, is to just realize that depending on where you are, there are factors with historic distrust that are there that you have to acknowledge. And some of the things that I tell people, just, you know, as general approach, is when you talk about collaborating, it really is about building relationships and starting small. If you know one person at a tribal community, even if they're not the tribal elected official or anybody, quote, important, if you've got a relationship with a staff person that's there, then start with that, and let it build from that. The thing that you don't want to do is just shoot off a bunch of letters to the tribal chairman or the tribal president or governor of your pueblo or whatever, the elected official, and just, you don't want to do that. And just say, we'd like to work with you. Please contact us at this number. It takes a lot more effort. So, I mean, that's just off the cuff. I think that's some of the first things to do is just remember you've got historic distrust based on things that are outside of your control. Start with relationships. I think the other thing is don't promise what you can't deliver. And be honest about if there have been things that maybe some of the reasons why the tribe doesn't want to work with you is something that happened 15 years ago with your department that you weren't part of, but you got to deal with it. So I think part of it is acknowledging if your department was part of the historic distrust, to acknowledge that and say, let's move on. I realized that happened. I wasn't there. Let's try to make a new start and just start building trust from there. So I don't know, Raquel, if you have a perspective from, I know Arizona's had some interesting conversations with past.
Yes. And you said it. I mean, it takes time. It's not something that's going to happen overnight, but really defining what you mean by collaborative. There is a lot of mistrust because of broken promises in the past, in general, and doing that baby steps where you're asking them, like, what are some needs, or how can I help or support you, and start building that trust that you will follow through on what you said or what you're going to provide, is the best way. And sometimes it isn't the best way to go to the top first, as Andy mentioned. Look at the programs that already, are working within your system, or have some type of connection that's going on, and try to work from there, because we all talk, we all, oh, this program did this and you're helping this program. So really strengthening what's working now, and just really trusting that path of where you need to connect to, and it's just, doors open when it's time, and it's all based on timing. It's really based on timing, and sometimes change in leadership, and just change in the community. And right now, I think with COVID is a good opportunity to show, that you want to help and provide services, and asking them, what is the need for them, and what they can help with.
Great, thank you both. And so we have a few more minutes. I don't think we have any more questions at this point, but if you have any questions, feel free to drop them in the chat. In the interim, Raquel and Andy, I wonder if you have any final thoughts or comments that you want to offer to this audience.
Go ahead, Raquel.
Wow. I'll just say, don't give up. If it's worth it, it's going to be hard. And I think that's why there's a lot of turnover in circles and systems, because you hit that wall where you think nothing's going to happen, and people feel like, I don't know the answer. Sometimes you have to trust that process, and things start falling into place. So if you're in circles of care right now, or systems of care, trust the process and really reach out to others and peers. That whole list that Andy gave you, if you call any of those tribes, any of those near you, they will totally open doors and help you, because we've all been through that. It's like you've been through a war, but it's the best. It's the best feeling once you're done, and you see the products, and looking 20 years back, you'll see it was worth it. It was worth the, all the work and the long nights and the wondering, am I doing this right? Am I doing this correctly? How am I going to help, but I don't have funds for services, things like that. So I would say reach out to those who've been through it, and they'll help you get through it, and don't give up, because it's worth it.
Thanks. Yeah, well, so I think I have a couple closing thoughts. One is that we've been talking about a grant program that the people have applied for over the last 20 years, and they've got funding to do this work. And I've always felt like you don't need this funding. If you apply and you don't get a grant, then that doesn't mean you're done. I know this because, as I mentioned earlier, when I was at the Puyallup Tribal Health Authority in the late 90s as the mental health director, the tribe at the time said, no, we don't want a Circles of Care grant. The response was, we don't need a planning grant. We just need action. We need, we don't, so let's not do this. But me as the director of the mental health program, I was able to take those system of care principles and just start integrating those into our program, into the work. So I, on my own, without any additional funding, I thought, okay, the key point with this is nothing about us without us. If you don't get anything out of this session, it all starts with nothing without, now I'm gonna mess myself up. Nothing about us without us. In other words, this is about serving children. Now, look at this hair. I am not young. I haven't been young for a long time. The things that I thought were cool when I was young are not cool anymore. So if I, in my gray hair and old age, think I have a cool program for the youngsters in my community, I'm going to be way off base. So what do I need to do? If it's about those youth, I don't sit there and come up with my own ideas. I don't talk to a bunch of people my age and say, hey, what do we think those kids need? Go talk to the kids. If this is about the kids, talk to the kids, get their input, talk to the families. It's about that. So when I was with the Puyallup Tribe, again, going back, I didn't have a grant. I took the initiative to say, I'm going to hire a family advocate who's a parent of a kid, and I'm going to find a way to hire them so that they can start doing this work and going out in the community, getting feedback from family members so we can improve. I didn't have a grant to do that. We just did it. We started doing some other things. And as I said later, the tribe ended up applying for a Circles of Care grant. I think it was in cohort 3. So we're talking about lots of money for a federally funded grant, but this work does not have to be funded by a federal grant. If you have leadership and you have a commitment to do this work and to make a change in your community, you can go talk to Raquel. You can go talk to other people who have been through Circles of Care and just say, how did you do it? And you can do it with what you have already. It's changing your mind, changing your approach. Take all those resources that you currently have that are set up to help kids with severe disabilities and high levels of acuity and all this diagnosis, which is important, but take that and take a different approach so that you're focusing more on what they need, strength-based, culturally competent. It's a shift in paradigm. It doesn't require a lot of funding. If you get the funding, it's great because then you have a lot of support to do it, but you don't need a grant to do this work. And I hope that's what some of you who don't have a grant, who are thinking about a grant, don't just wait for that grant to start. You can start this work now. If you got a Circles of Care grant and you didn't get a System of Care grant, that doesn't mean you roll up your carpet and say, well, I guess we're done. That was a fun ride. Let's do something else now. You can still find ways to build that on that. So I mean, those are some of the things that this is about lessons learned over the last 20 years. Circles of Care, I think that's kind of the gist of what I have to offer in terms of lessons learned. I will just say in closing, it's really been my life's honor to work on the Circles of Care program. Like I said, I'm a commissioned officer in the U.S. Public Health Service. I've served 30 years. Next week is my last week. I will be mandatorily retired. So this is my parting gift to the communities. So hopefully this will be recorded and people can watch it and say, yeah, I remember that guy talked about this or that, and that helped. I hope something that I've said is helpful, and Raquel will still be around. I'll be around one way or another, but I am not, I've got other things in life I want to do, but anyway, I don't want to talk too much about myself, but I do appreciate the opportunity, and I hope that all of you have gotten something out of this. And if we said something you forgot, then the beauty of this medium is you can go back and rewind. So that's all I got. Thank you very much, and I hope you have a good rest of your days. That's all I got.
Well, I just want to thank both of you for sharing your expertise and your strategies with us today. And thank you to our interpreters, Jessica and Henry. And thanks to all of you for joining us for this segment of Training Institutes Live. We would appreciate you taking a few moments to complete the evaluation for this workshop using the link that's posted in the chat. We take your feedback seriously, and it helps us to shape the upcoming series. As a reminder, this summer, take us whenever and wherever you go. July and August workshops will be released the first week of each month and available to you all month long. Listen and learn to a select group of workshops and listen to all of them along your way. The link to the workshops on the website is posted in the chat. Again, thank you for joining us today, and we look forward to seeing you wherever you go in July.